On behalf of Region 7 and the Ask for Respect Supplemental Grant, we want to welcome you to our series of interviews focusing on the perils and pearls of lessons learned regarding COVID-19. Our hope is to share the lessons our colleagues have learned and to assist you with your healthcare journey during this pandemic. Thank you for listening.
Hi and good morning. I'm Angie Vasa. I am the Director of Isolation and Quarantine Units here at Nebraska Medicine, and I'm really excited today to have Dr. Chris Kratochvil and Ms. Morgan Shrader join me for a conversation about sports and COVID-19. I'd like if each one of you could give a little bit of an update about your background, what you're doing at UNMC or Nebraska Medicine, and talk a little bit about your role in sports, and that might give our listeners a little bit of an idea of why we invited you both to be on this panel. So I think Chris, if I can call you Chris, we can start with you.
Absolutely.
Great.
Thanks, Angie. I really appreciate the opportunity to be here with Morgan today. I serve as the Associate Vice Chancellor for Clinical Research at UNMC and the Vice President for Research at Nebraska Medicine. So really what I do is I help coordinate our team that works together in clinical research for our academic health center. I also serve as one of the executive directors of our Global Center for Health Security, which is our, again, a very broad team of experts that work on health security measures. So thanks for having me today. I guess, and the sports-related aspect that I work with, which is why I was invited. I serve as a chair of a Big Ten committee, which is a task force on emerging infectious diseases.
Great, thanks, Chris. Morgan, you tell us a little bit about yourself.
Good morning, my name is Morgan, and I'm a member of the Nebraska Biocontainment Team as one of their clinical coordinators, and I get to work with Chris and Angie on various projects here at Nebraska Med UNMC, one of them being the co-director of one of our training components here. I believe while I was invited, conversation is around that I took a voluntary medical coordinator position for one of our local sports clubs, and so learning how we engage just about 1,400 athletes in the club on being able to practice and train and play games regionally and nationally, and while maintaining COVID safe measures has been a ongoing learning opportunity as we navigate.
Mm-hmm. And I think I would also highlight, Morgan, that you have a unique role in that you are also the parent of athletes. And so you have kind of dual interest in the safety measures and the emotional and developmental aspects of sports for youth. So not just the safety coordinator and the nurse for the program, but also looking at it from a parent's point of view. And so maybe we can delve into those maybe sometimes competing interests a little bit.
Those are competing interests. And that's why I kind of didn't bring it up is because what I want and believe to be the best, it isn't always fit into the measures directed by CDC and other governing bodies as the Academy of Pediatrics and others so forth. So it's a fun tightrope to walk.
Absolutely. So I think I want to ask you both, why do you think sports are so important to our young people and to families? And as we think about kind of these competing interests, for lack of a better term, how do we balance the need for social interaction, for athletic development, for the development of the team, with all of the directed health measures and safety principles? And why do you think that sports has been such a focus for not just youth, but all the way up through collegiate level athletes?
Yeah, those are really great questions, Angie. And maybe I'll start because my kids love sports, played a lot of recreational sports, really didn't get into the club sports or the higher levels. So we'll let Morgan address that bit. But I think, at face value, clearly just the physical fitness, the exercise is incredibly important. But I think as you're alluding to, there's a lot of other things that are there. And as we look at what are the potential risks and benefits of kids playing sports in a pandemic, I think we have to look at what are the other things that may not be at face value as one of the benefits, but clearly they do play a role. And, the whole idea of teamwork, being able to set goals, letting them address challenges and obstacles, working together with their peers, and really building confidence in themselves. They set and achieve goals, but also really just an opportunity to work together, to be with their friends, and to try to do things to better themselves and better the team as a whole.
Yeah, I couldn't agree with you more, sir. There's a healthy balance when kids are engaged in extracurricular activities, and sports is one of those avenues, as to we look at their self-esteem, the structure that sports provides, the ability to be accountable, the constant learning and refocus as to what we're doing, what are our next goals, what are our next avenues for improvement, the coaches' touch points. Teachers, when we have, it's kind of a twofold question, Ange, schools are sometimes online, 100% online, and you don't have those touch points. And coaches have a different relationship with their players, and in that engagement and holding each other accountable. And so if we omit that, there's another conversation to have is what trouble are we causing while we don't engage in sports, along with the importance of sports. So I think there's this crazy balance that we're all trying to watch, because when we look at athletes or student athletes actually that aren't able to engage currently in their extracurricular activities at schools because schools are mostly online, we're seeing a rapid decline in academic performance, which is a lasting effect, because this is a moment in time. This is hopefully going to be better by summer, right? I think we all agree. But in that year of classes, 18 months of classes, have we fallen off the rails, from an academic recovery standpoint? In sports, that structure. Because if you're not academically sound, you can't participate in sports. But if you remove the sports component out of it, then you're looking at, hey, how am I going to get these kids to be re-engaged, in their performance?
And so I think when we, hearing all of the things that you guys are talking about as far as the benefits to the people who are participating in sports, not just the sport player, but maybe talk a little bit about, what that does for family units. Because I think we talk a lot about the individual benefit for the person playing sports, but I think from both of your perspectives as parents of athletes, what does that do for the family unit, and what are the benefits for the family?
Yeah, another great question. And you're exactly right, because many times the kids playing sports are really a great family activity. They're outside, they're doing things together, they're interacting. For many families, it's one of their social activities between other families as well. And I think, particularly being outside is something we're really promoting during this pandemic, and getting families outside, and those outside interactions are good. But I think also, that activity helps bring some normality to folks during this crazy time we're having. I think it can be a distraction. And even with these COVID restrictions in place, there's a lot of things we can do to safely bring families together, following some of those restrictions and safety measures that we want in all domains.
No, agreed. Just getting them outside of the house, as a family unit, because most kids can't drive. You figure about your population, first grade K through, I'm going to say junior year in high school, they're not able to drive. So then families, take them to soccer practice. You have an opportunity to go on a walk and, engage in the space that they're practicing and training in at a safe social distance. So we've seen a decent amount of that engagement, which has been wonderful. Women and children and husbands all going on for long walks while their kids train for an hour and seeing that. So that's been really lovely, to see that outside engagement.
So those are really, I think, great examples. And I think to follow that up, could you guys talk a little bit about what restrictions or safety measures you're taking or that you're helping to promote in either one of your roles related to club sports or the higher education sports, and just maybe expand a little bit on the restrictions that are currently in place and a little bit more about the process that each program takes to evaluate current status and make recommendations to make sure that we can continue to promote sports activities in a safe way.
Yeah, so I think as we look at the kind of guidances that we have for safety measures, for restrictions, many of those are the same ones we push in really all the domains that we interact, whether they be in schools or socially or at work, masking when able, distancing when able. And, here in Nebraska, the governor is often talking about the 3 C's, avoiding crowded places, close contact, and confined spaces. And I think in sports, we want to continue to do those as much as we can. So confined spaces, for example, as we're traveling, we want to limit the number of people in a vehicle and wearing masks when they are. Now, if we look at what we're doing in college athletics, Many of those things are there, and they're much more tightly orchestrated, in fact. So if we look at what the Big Ten did, the Big Ten formed this task force March 7th, so early on, to start putting together some guidances to safely bring athletics back. And in fact, that's part of why the football season was postponed while some of those safety measures were being put in place. And colleges have taken this very seriously, and everything from how athletes eat, how they're distancing during studying, how they're traveling, what they're doing in the weight room, how they're sanitizing things. So all of that has to be taken into account, because there are some things that the student athletes may be doing that may put them at risk. So how can we mitigate those risks? Even going so far as wearing masks during practices and things like that.
Great. And Morgan, how has that translated down to the club level sports or for some of the younger age groups that you're working with?
Right. So I had the pleasure of borrowing some of the documents that Chris had sent out as to learning how, we're not the Big Ten. Our funding looks remarkably different on acquisition of resources. But, looking at how they're addressing, trainings and environments like that. So March 7th, I think it was what the date Dr. Kratochvil said is that we started in April with a return to play document, kind of to support twofold: education on the current, knowledge about SARS-CoV-2 or, COVID-19, and then also what are we requiring or asking and recommending of our coaches, parents, and players. That document has been evolved quite a few times, and it's posted, on our club website. We send it out when needed refresher knowledge as we see trends start to go. And then we also partner with our local county public health counties as identifying where our risks are and how do we start to mitigate those. So some of our maybe more applicable non-college application is that we spaced out training. So players are only allowed at the fields. They can't leave their car until training is going to start. We built in a little bit of time, and there's a one-way directional flow, kind of picking those pieces of biocontainment as well. From experience, you enter one door, you exit at a different door, so there's no crossing. We do require masks when you're entering the field space and when you're doing small-sided engagement, meaning you're going to be face-to-face with somebody, for not even a long period of time, but enough that you would say, hey, I think we should wear masks on here, and allowing coaches to kind of assess the risk and being able to say, hey, masks come out, we're going to socially distance and do some, sprinting or some, running at a safe distance in space. A lot of cleaning and disinfection education from the training facilities that we're utilizing. So no, hand sanitizer at the front entrance, parents that have young children, and I can't remember the age that we said under this age, parents can come in and drop off players, but one parent has to be masked as well, and then they need to leave. Really educating as to what the CDC guidance was and our local public health guidance is on isolation versus quarantine. They're remarkably different, and explaining the risks when somebody in your household is diagnosed with COVID-19 and why we're keeping your player out of training for the set amount of quarantine period. So it's been a lot of education, coaches education, a player education. That's a high school age players. They want their friends, right? We all know their friends are a vital part of their life, but really helping them understand that if you go to dinner with 18 of your closest friends, at a long table, and one person has COVID, you not only impacted the 17 other individuals, but you also impacted their families, in terms of a risk. And so then not only can you not play sports, you now have a whole nother pickle, that you've got to manage for a while. So it's ongoing. I mean, and outdoor sports looks a lot different than indoor sports. As we're walking in, we don't have the pleasure of living in some of the regions that it's still 60 degrees and you can train outside. So we're having to look at how do we revisit those policies in indoor settings.
So I want to ask a question. Something that both of you had said was the idea of wearing masks during practice or during physical exertion. And we get a lot of questions from the public or a lot of comments about how difficult it is to breathe, how hot it is wearing a mask. And so I would love to ask you both if you've gotten any feedback from players who are participating, who are wearing masks while doing drills or sprints or practice, and how that feels for them, and if it's inhibited their ability to really perform to the top level by the addition of masks during, sports-like activities.
Yeah, so I can start and then I'll let Morgan weigh in. I think, part of it depends on what the sport is and what the activity is. And certainly that's one of the reasons we really encourage to do as many outdoor activities as we can. How can we mitigate that risk and, have people maybe in venues that they might not need to wear masks, or if they do, maybe it's cooler or things like that. And the other thing is what we see is that some people can perform pretty well with a mask, and it may be uncomfortable, but again, how can we mitigate those risks? So I think any time that we can have people wear a mask, the better. Now, in a football game, clearly that may be much more challenging, but as soon as you get to the sideline, certainly put that mask on. And we're seeing professional sports do much better jobs of that, and they're figuring out what masks work, what are comfortable, how they can perform best. But everyone knows that the more they can do, they protect not only themselves, but their entire team. And
Absolutely.
What's the action they can take for the greater good to help protect the safety and health of the team.
Right. I agree wholeheartedly. We also perform education on mask etiquette. Wearing your mask underneath your nose. Hey, by the way, that's where we go get your specimens. You might want to type thing. And, and the inability to perform hand hygiene every time you touch your mask, and understanding those risks. These are smart. Everybody is smart, but you provide them the education, and allow them to kind of walk through the reasoning behind it. And there's, these lovely light bulb clicks on that. And we also provide this education to the parents and the coaches, as well as to why we're able to wear masks and things. There's a great article that was just published by the American Academy of Pediatrics, and I encourage people to read it, on the reason why they're actually pushing now to wear masks in some sports. They do exclude swimming because so they say that it's a little hard to breathe with a wet mask in front of your face. I would agree with that. Wrestling is another one. It might be considered a choking hazard. Agree with that as well. But other sports, is there a way that we can train, and have players build up to being able to wear that mask? You can't throw them at them, the day before the national championship game and say, hey, I want you to put this mask on and go play your best basketball game,
Sure.
Allow them, to kind of get acclimated to. It says that in the studies, it takes about 3 or 4 times for them to be fully able to perform at their best with the mask on, because it's something different. It's no different than tying a parachute to the back of you and ask you to run a marathon. You can't ask for awesomeness the first day. It's going to be a bit. So just again, and then what constitutes a good mask, Angie? And I know this is all on kids on sports, but you look at snoods that are worn, and you look at certain masks that are worn and things like that. How do we educate people on what is a proper mask and it's not helping the situation at all? And so, I think lessons learned from this ongoing response now 10 months in, is how do we get that information out at the beginning? Because people are like, well, I bought this single layer snood that looks like a transparent piece of cloth. Is that okay for me to wear? And I'm like, no, that is not okay for you to wear. We need double cloth layers, tightly woven, secured to your face, so you're not touching it all the time. So I think we'll have a great report out in a couple of months on some of these.
Well, and I think to add on to that, it would seem that might be the highest population that's at risk for wanting to buy a vented mask because of the comfort of being able to exhale. And I think kind of reiterating that the vented masks are not appropriate for source control because while you're, filtering things into a small degree, everything coming out through that exhalation valve is unfiltered. And so it actually negates the purpose of wearing the mask. But I would think that, that might be a group that would potentially want to pursue that because it decreases the resistance of exhalation. So I think you're right, though. It's for those clubs and the directors and the coaches to reinforce, what is an acceptable mask that we would allow to be used.
Yeah, I think that's hilarious that you brought that up because I omitted those in April. from our from our return to play documents. That was at least included, just not the single cloth layer masking. I was like, yep, I don't want to see those. Those need to be, because, and again, it's education. How do we engage our parents? They want their kids to continue to play sports, and so how do we engage them in being part of the solution and not become part of the problem,
Absolutely. So I want to ask you both another question, as we're talking about kind of sports that might have increased risk or that have a decreased ability to implement masking. And if you've been involved in any of those types of sports, like wrestling as a good example, it's a close contact sport, multiple reasons why you can't reasonably wear a mask during a match. So I wanted to ask if you guys had been engaged or involved in any of the conversations for those types of sports, and if you have any advice or suggestions for referring to the best guidance for people involved in those types of sports to refer to.
Yeah, so these are challenging questions, really. How can you mitigate the risk in a time that you're going to have all that really close contact? And I think that there's a couple things that you have to look at. I talked earlier about the risk benefit. So part of evaluating the risks are, what's the community spread at this time? If you're in an area with very limited community spread, you're having, in college athletics, there's frequent testing, things like that. There's some things that you can do to mitigate the risk, and, any sign of any symptoms, things like that, you're checking people. They're very rigorous on monitoring social distancing and masking and other things. There may be things that are mitigating the risk to help balance that risk-benefit relationship. But as you get more prevalent spread in the community and, spread on teams and things like that, that's when it becomes much more challenging, and it really is important to weigh, can this safely be carried forward?
Yeah.
And I'd like to add to that, sir, if you are going to a tournament, in wrestling being it or any sport, that's out of your region, working with that tournament host, what are you doing for these athletes? How are we going to mitigate risk there? Is there a document that we could push out to educate all of the attendees prior to of what we're going to ask of them? So having had the pleasure of attending a couple of national events in various parts of the country, twofold education happened to our players and our parents and the coaches that were attending. That we talked about the community spread in the area that we're going to. What are the public health measures in that document? What are things that we can do to keep that risk low? What is our current community spread in our own county that we live in? What are our measures? So they have a kind of like this crosswalk of information as to, what do I need to do when I go to, Phoenix or South Carolina, Greer, South Carolina? How do I get there in a safe measure? Meaning education on, you can eat and drink prior to getting to the airport. But when you get to the airport, your mask needs to be on. And then, if you have a long layover, find a socially distanced space where you could get a glass of water and a snack. Your mask will stay on when you use the restroom. Please do not use the airplane restroom, if at all possible. Providing some of that education, and don't take your mask off if you do have to. Some of those educational touch points we provided, because it's something that's not necessarily in their norm.
Sure.
As to that, and then also working with the screening platform for athletes that are coming on the field. Again, can you have a medical person on site that does all of the athlete screening, so they see them for multiple days, and you can kind of, using your skill, be able to say, what's going on? How come you're a little peaked today? That way, on top of temperature monitoring, symptom monitoring, touching base to see if you've had any notices come in from your local public health department regarding school related exposures. How is your family doing? All of those questions being asked the day of the event, and then also impacting the families that are going to those events. Please eat before you come. There's not going to be food on site. If there is going to be food on site, talking to the host facility and saying, can we not do this? The risk of spread in eating in these close, these small environments, especially if it's wrestling and it's in a gym. The gym is large, but you put 100 people, that gym becomes small very quickly.
Absolutely.
Can we use Zoom so it's just the athletes in the gym, and parents are watching via Zoom, in other designated areas? I think instead of saying, no, we can't host sports, it's how do we do it in a safe measure, weighing our risks, on a risk assessment scale. And there will be times where you're like, we just need to cancel. because the community spread, there's too many players out with COVID exposure, the risk is too great. But if we educate beforehand, I think that we can safely carry on some of these events and provide that balance for our athletes and families.
And Morgan, just to build on one of the things that you mentioned that I think is critically important is that we really need to look at the entire day of the student athlete. What's happening at that times that they're, on the bench or in pregame or, socializing with their friends afterwards and, going out to the restaurants and things. There's so many things that, if you have holes in the plan, COVID's going to come in through those holes. So it really has to be a lifestyle change and not just what happens on the athletic field.
Agreed. And really relying on the athletes to be the ones that are driving that. I know that sounds a little bit odd because you're like, they're young. And I'm like, yes, but they're young and this directly impacts them. So if after the game, if 20 people want to go to Topgolf and they're like, oh, okay, because we're only going to be in groups of 10 and we're going to eat communal food and we're going to do all these things. While I love that they want to engage in that interaction, it's a risk that is unnecessary to take at this time because the impacts can go on for a month. When you see and hear stories of athletes at the college level, sir, and you could probably speak to this, that have been in quarantine more than they've been in class, or more than they've been able to train because of the continuous, well, Angie, you've got it. And then you were around Dr. Kratochvil, and then I was around Dr. Kratochvil. So now I'm in quarantine. And then we circle back around that, well, now I'm the one that has it. And I hung out with you. And, it's this constant, circle of events that you can't get out of unless you're willing to say, well, I love having those conversations, those touch points, Angie, and the meals. But in Dr. Chris, we're not going to be able to do that for at least until maybe June of this year, 2020.
That's not a firm date.
It's not a firm date, but I'm holding on to it. That by June, maybe we can start to do some of those activities.
Absolutely.
That would be so good.
So I think the last question that I have for both of you is, are you currently now doing routine testing for players as part of a standard surveillance program? And that might be a very different question for the work that you're doing, Chris, with the Big Ten versus the work that you're doing, Morgan, with the youth sports. But I think that that's an ongoing question of what does routine surveillance look like versus testing due to exposure and or symptom presentation. And just wondered if you guys could expand a little bit on what you're currently doing or suggestions that you would have for folks to look into if they wanted more information.
Yeah, so from the NCAA level, the NCAA actually has guidance for testing for sports broken out by contact risk. So kind of low, intermediate, high recommendations that they have for testing. And then each conference can adapt that to suit their needs. So there is testing protocols in place for the Big Ten and other collegiate programs, and that is helpful. But that's just really one tool in the tool chest that can help benefit, can help identify early. But really, it's one small piece of a big picture that has to be complete in order for the student athlete to be able to participate safely.
Great points. Morgan, anything that you would add?
So we don't have the ability to test, broadly at this point in time. There has been a request made, but we've got to walk through that to do either saliva tests or something when we have big events coming, to some of these areas on the national level. What we do in terms of screening and engagement with parents is that if a player is omitted from class, meaning, they're not in a hybrid, or maybe they are in a hybrid, but they had an exposure at school and they're placed into quarantine, or they themselves have been placed into quarantine, we follow the public health recommendations based off of that. And we ask that we be aware of that so we can track, educate and train, because sometimes they have some younger siblings that then, maybe potentially impacted on some of those levels.
Sure.
I'll tell you, for college ID camps and recruiting events that we've hosted here in Omaha, we've made the request from anybody outside of our club to obtain a COVID test before coming within 72 hours. Now, this has been a request test. It hasn't been mandated, but most people are more than willing to do that because we understand how we're running business, our policies and protocols. They love it when they see their medical coordinator walk in their room to make sure that they're facilitating all of that. So there's some compliance
Sure.
checks in terms of that. So we've requested that outside players from outside states or outside clubs in the region to acquire that test. We do all screening before that. So there is a medical representative, whether it's the trainer or myself or another individual that we've asked to step in and fill a role if we're unavailable. We have touch points with athletes 30 minutes before they are supposed to take the field, so we can understand and make sure that we all know sometimes what it looks like, to have a fever. And we're also balancing, influenza season and some of those other things. And
absolutely.
So we have those touch points. Hopefully that does cut our risk down. And we've been fortunate enough from, having 1,400 athletes training since June, that we've not had an exposure related to training. We've had kids that have been placed into quarantine or kids that have acquired COVID from school, but it hasn't been related. And fortunate enough that, given guidance that they weren't at training 2 days prior to, symptoms and some of those other things. So really owning that process and having that open conversation with parents and having them being part of the solution, it has been beneficial on top of all of our screening that we do before national events or local events even.
That's great. So I want to thank you both for taking the time out to sit and chat with us a little bit. I know that, in these current times, there's a lot of focus on sports and what activities can be done safely. And I think just to summarize, some of the things that we talked about was really the importance of the social interaction, the structure that sports provide, the physical exertion that people need to be able to get when we're imposing a lot of other restrictions. And then really being willing to look at all of the risks, balance out the benefits, and sometimes have to make those really hard decisions of when do we say the risk outweighs the benefit. So really appreciated both of your perspectives and your time in bringing your expertise to this Region 7 Perils and Pearls Zoomcast. So thank you both for your time.
Thanks, Angie.
Thank you.
Thanks.